Joining us today is Dr. James Pickney, and Dr. James is a medical expert. And Dr. James, welcome to the Tom Marr Show. Happy to have you today. Doctor, are you there? Doctor? Happy to have you today on the
show.
Yeah, very, very good that you are with us. And, you know, I know the vast 99% of the doctors I know are really in there to help people. But now the family doctor, we're running into a short supply of that. And people, as you say here, they go in to see the doctor. The doctor would like to spend more serious time with them, but can't, down to a few minutes, because there are so many people out in the waiting room. What's going on here?
You know, that's exactly right. Unfortunately, primary care is going into extinction. Physicians are spending 60 cents on the dollar in order to collect reimbursement claims from insurance payers. That is a terrible rate. And when they do receive a claim, it's about 17 cents on the dollar. So you can't operate a business like that. And things have to change. The Affordable Care Act has injected 6.7 million new users into the system, an already cramped and overwhelmed system, and eventually things are going to break. So what I've done at Diamond Physicians is create a different model where we don't use insurance, where we go directly to the patient-physician relationship, like back in the 60s, 70s, and truly provide affordable health care to America.
Now, would that mean what you have come up with here, by the way, and I have a wonderful internist who spends as much time with me as I need, and in fact I saw him yesterday about a number of issues, and he is just that kind of doctor, but I know they're running into short supply. Are you moving into the area, or do you recommend moving into the area of what would be known as concierge, where you would pay your doctor a fee for the year, which would be a decent fee, so the doctor could keep his doors open and spend time with the patients?
That's exactly what I recommend.
I know a lot of people are opting for that.
Yeah, it's the only way to keep your business open, keep the doors open, and take care of our patients. The average face-to-face time with a doctor is 8 minutes. At Diamond Physicians, our average is 60 minutes. So we charge $45 a month for kids. Adults start at $95, no pre-medical conditions. And that's for the entire month. Unlimited visits, no copay, 24-hour access to your doctor. So a lot of people think concierge is too expensive, too luxurious, but we're changing that. We're calling it affordable concierge, or direct medicine, where you have direct access to your doctor and truly affordable health care. We include all acute medications and acute procedures. So if you cut yourself at 9 o'clock on a Thursday night, I meet you at the office, stitch you up, have you home within an hour, and it's included. So
let's just use a round figure, $100, and you're going to charge that monthly. So for a year, that's not that much. To have that ability, and hopefully people don't need a doctor a lot. They need a doctor a couple of times, at least once a year for a physical. And I would start recommending that people get their yearly physical, frankly, in their 40s or in their 30s. But this turns out to be something very important, and I think it's one of the only really great alternatives there is, because people are finding out not only do they have less time with the doctor, but they can't find one.
That's exactly right. You know, we're totally reinventing the healthcare delivery system. In our current model, there's no incentive to stay healthy. If you're healthy and don't go in to see your physician, the physician doesn't make any money. But in our model, we want to keep our clients healthy. The healthier our patient population, the more efficient my business runs. So everyone is aligned. We're in this journey together. And that's the only way we're going to lower the cost of healthcare globally. The government is going to spend $2 trillion over the next decade in insurance subsidies to the 5 major payers: Aetna, Blue Cross Blue Shield, Cigna, United, and Humana. That's $200 billion a year for a product that is inferior, networks are shrinking, doctors aren't taking it, and insurance premiums are rising.
Well, and do you know, shed no tears for the insurance company, because Dr. Betsy McCoy, who is the world's most renowned expert on this 2,700-page monstrosity known as the Affordable Health Care Act, or Obamacare, points out chapter and verse where the insurance company, unlike you as a doctor, the insurance companies are going to be reimbursed 80% for anything they may lose. Dr. James isn't going to get reimbursed by the government for anything he may lose, so he is going the other route, and I think it's a sensible route to go, and if people stop to think and look at it. But then what do you tell your patients if they need a specialist or need hospitalization? What is your answer to that?
That's a great question. And we do recommend a catastrophic piece. So a high deductible plan, lower your monthly insurance premium as much as you can, and that way you're covered for surgery, for hospitalization, for a catastrophe. And that's how medical insurance should be used. It should be used like car insurance. When you fill your car up with gas, you don't make an insurance claim. You pay cash. When you need new windshield wipers, when you need new tires and oil change, you pay cash. The same method should be used in primary care. When you go see your doctor, when you need a flu shot, you should pay cash. And that's how we can lower the cost of health insurance.
And that would ensure, and I'm just going to use a figure here, that let's just say a $4,000 payment would be enough to ensure that you could, A, get to see a specialist. That would be cared. And, of course, once you get into a hospital, your care in the hospital would be taken care of as well. I do warn people, however, that most hospitals will be up front. Some aren't. When they now say, doctor, we'd like to keep you overnight for observation, you might get one hell of a bill the next day unless you're admitted.
Oh, that's exactly right. I mean,
right.
Even if you walk in the ER, your bill's not going to be any less than $2,000.
Wow.
So, and we try to change that. And if you are admitted for a day, it's going to be at least $10,000.
Yeah, but if
probably close to $15,000.
If they're going to keep you for observation, you get a lot of money. If you get the insurance to cover it, then you're all right. We took the finest healthcare system in the world, Dr. James, and we've really messed it up something awful. Hopefully, the new Congress can not only repeal, but they must replace and go back to the older standard. Do you think I'm right or wrong?
Oh, I agree with you 100%, but unfortunately, I'm very skeptical to see if that's going to happen. Now, we may be able to reform parts of the bill, but I think it's almost impossible to repeal the entire piece of legislation because there's so many different sectors that are involved in the Affordable Care Act. There's education laws weaved into the fabric of the law.
Oh, yeah. A couple in their 60s have to pay pediatric dental care. I mean, and birth control. It just doesn't make any sense. But listen, it's been great having you today, and I'm going to tell our listeners to get their congressional delegations, and I'll do this nationally next week a couple of times.